Hello guys, this is Dr. Palaniappan Manikam again. I've been asked so many questions about the vaccine news, so I thought I'll just make a quick video regarding the frequently asked questions about the newly released Pfizer vaccine. Let's get right into it. So the first question I'm asked is who will get it first and when will it be widely available? So the first people who are going to get it is the healthcare workers and all the residents of the senior nursing homes who are at very high risk. So to give you a number, there are 21 million healthcare workers and 3 million senior nursing home residents. So this 24 million people will be the first who will be getting the vaccine right away. So this will be followed by 87 million essential workers who are not related to frontline healthcare profession, which will be followed by 100 million people who have certain high-risk conditions like diabetes, hypertension, obesity, those kind of comorbidities, which will be followed by people who are 65 years and older. If you do the math, it'll come around like 250 million people to be vaccinated first, and then it'll be translated to an average risk person or patient. So in my hospital, they're talking about giving vaccination to healthcare workers already. I'm glad that I'll be getting the vaccine soon. At least one advantage of being a doctor. And one of my friend was asking, is there any course that I can study to become a doctor right away? And how much does it cost? The answer to that is your entire youth life. So even within healthcare workers, it will be triage. Not every healthcare worker gets the vaccine right away. People who are seeing COVID patients directly, like emergency physicians, ICU doctors, lung doctors, and all the other specialists who are doing procedures on patients who are at high risk, might be getting this vaccine sooner than the other healthcare professionals who might not have direct close contact with COVID positive patients all the time. So it has been triaged even within the healthcare system. And I think for me, they are giving me a time around like January 15th. So that is the Pongal time. So when everybody is saying Pongalo Pongal, I'll be getting the vaccine. As far as they don't say Govinda, Govinda, I'll be okay. So I'm anticipating 3 months to vaccinate all the healthcare workers and also all the high-risk patients. So January, February, March, and I think by mid-April, it'll be widely available for average risk patients. So one of my friend was asking if I stand in line the night before and as soon as the door opens, can I get the vaccine? And I think he's confusing the Black Friday deal with the vaccine provider. One of my other friend was asking, hey, Dr. Pal, can you put in a good word for me or recommend me to get the vaccine sooner? I think he's confusing this with getting an admission for his kid in the kindergarten school by providing recommendation. I think this is different. One good news is vaccines are ready. They have started shipping this weekend. In my hospital, most likely it'll be available by next week, and even few of the healthcare workers might get it even before the end of the year. So this is great news. And the second major question I've been asked is, are these vaccines safe? Are there any side effects? I completely understand the rationale behind this question because this vaccine was developed within a year and was so fast. It has never happened like this before. But I should tell you guys that this vaccine has developed on a completely different technology compared to the regular vaccines. And actually, this is a much safer technology, and actually the scientific community is praising the scientists that using this newer technology, we could even develop more vaccines for multiple other diseases. So this is like a groundbreaking research in scientific community. Pfizer vaccine trial have included 44,000 patients, and in 44,000 patients, no serious side effects was noted. This is a great news. The most common side effect that they have reported is when they give you a vaccination, you might have some redness in this area, some swelling, and you might feel a little bit tired and maybe a little bit of fever for 24 hours. But actually, if you get tiredness and fever after vaccination, that might actually be a good news for you, which means that your body is responding to the vaccination, and usually it doesn't last more than 24 hours. So except for this minimal side effect, there is nothing major that has been reported. So as you guys might have known, UK has started giving the vaccination to the healthcare workers already, and 2 of them started having some allergic reactions. So the FDA is recommending that in case if you have very severe allergic reactions to a point that you might have to use an epinephrine injection, then you should be a little bit cautious about this vaccine. You have a simple dust allergy, pollen allergy, or if you have any other mild allergies, this is not a contraindication at all. This is not like the medication advertisement that you see on the TV where they list down all the side effects as fast as possible and then finally they end by saying including death, and the person in the ad keeps smiling. This is not like that. So all the Pfizer vaccines is getting transported at minus 70 degrees centigrades in dry ice, and they have worked out the logistics very efficiently, and most of the hospitals will be getting it by next week. And also in addition to it, there is a Moderna vaccination that might be coming up in the next 2 weeks as well. The more the merrier, because we could see between these two vaccines which works best in a particular certain subgroup of patients. For example, Pfizer might work better for elderly patients and Moderna might work better for younger patients. Competition is good actually in this case. So we are all very excited to get the data from Moderna as well. Again, vaccine looks very, very safe. All these vaccine researchers are spending time in the laboratory looking at the experiments, and all the anti-vaxxers are researching the exact same thing, except that they are sitting down in their restroom. Okay? And again, be safe for the next 3 months. The one thing that you can do to protect yourself and the community is to get vaccinated as soon as it is available. I will see you in the next video.